Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. What are the causes for psoriasis? It can be genetic or acquired. So, if any of your family members or first degree relatives has psoriasis, you are more prone to get this psoriasis. Not only what happens is trauma to the cell. So, any trauma to your skin, it may trigger psoriasis. In winter, some of the patients get triggered this in winter. So emotional stress is one of the main reasons. So when you are under emotional stress, cortisol is released. Cortisol has ability to multiply this psoriatic or keratinocytes. So depression, if you are in depression, again cortisol is released. This is the pathology. Focal infection, if there is any infection on the skin, it may trigger psoriasis. Pregnancy is also one of the major causes for psoriasis. Even in pregnancy you may trigger uh, psoriasis. Upper respiratory tract infection, especially streptococcal infections. If you are infected with streptococcal bacteria, you are more prone to get psoriasis. So some of the drugs, such as the drugs which are used for controlling the BP, like beta block inhibitors, beta blockers, are major reason for psoriasis. NSAIDs, non-steroid anti-inflammatory drugs, or painkillers. You regularly go to medical store and you get them for pain, reducing the pain. These are the major reason. These are one of the reasons for triggering psoriasis. Withdrawal of steroids. What is a steroid? Steroid is an immunosuppressant. So for any reason, if you have used a steroid for a long time and you have stopped it suddenly, what happens is it will trigger the psoriasis on the skin. So some of the antibiotics, even antibiotics are known to produce are the triggering factors for psoriasis. So metabolic syndromes, if there is metabolic syndrome is diabetes, hypertension. So if you have the metabolic syndrome, even that is causing the psoriasis. Diabetes, yes, we already discussed it. uh, Cardiovascular diseases, even obesity can trigger the psoriasis in some cases. We have understood the normal structure of the skin, normal physiology of the skin. Now we look into pathophysiology of pathology. Means what are the changes in the body that will occur when you are having psoriasis. Psoriasis is an autoimmune disorder. What is an autoimmune disorder? Normally, if a parasite or if a protozoan or any bacteria or virus comes into your body, our immune system should act against it and defend us or kill the pathogens that are coming from the outside. In autoimmune condition, what happens is your body cells, your body immunity is going to attack the normal cells. In this case, what happens is the immune cells within our body are going to attack the keratinocytes in the epidermis of the skin. That is the major reason for producing, that is the pathology for producing psoriasis. So what happens is, normally it will take 21 days for keratinocytes from the uh, basal layer to move into upper layers and lose the nucleus. Here what happens is, they will move within 3 to 5 days. Instead of 21 days, they will move within 2 to 5 days. And also they will not mature. Not mature means they will not lose the nucleus, they will still have the nucleus. And these we call them as immature keratinocytes. On top of it, redness, swelling, itching, and burning are due to the inflammatory mediators around the basal layer, around the keratinocytes. When immune system attacks, it will release some immunomodulators or inflammatory mediators. So this is the cause for redness, swelling, itching, and burning in the case of psoriasis. So there are different types of psoriasis based on the pathology. One is guttate psoriasis. Guttate psoriasis you get when there is streptococcal infection of the throat. When the throat is infected with streptococcal bacteria. So what you see in this type of psoriasis is, you see papules around the trunk, around the abdomen or back, around the abdomen. So these are the papules. Papules are elevated structures from the skin. The lesions are elevated, and these are less than 5 millimeters of diameter. So next is unstable psoriasis. Unstable psoriasis is a psoriasis when it is transitioning from guttate form to plaque form. This we call as unstable psoriasis. Erythrodermic psoriasis. Erythrodermic psoriasis is the most notorious forms of psoriasis. In this, what happens is from head to toe, not it will not even single inch of your skin. It becomes red, it becomes inflamed, it becomes painful, it becomes edematous. So this is a severe form of psoriasis. Pustular psoriasis. In pustular psoriasis means what happens is blisters like things, blisters like lesions come on all the skin. So blister is when the skin is burned, so you will get a blister there. Such type of lesions are seen in this pustular psoriasis. One is generalized pustular psoriasis. In this, what happens is entire body is covered with this pustules or the blister kind of lesions. So next one is acropustular psoriasis. In this, what happens is tip of the fingers, one or two fingers will get the pustular lesions. So it is also one of the most common ones. And next one is palmoplantar pustulosis. In this, what happens is your complete palms, both the palms and your soles are covered with this pustular lesions. This is one of the most painful form of psoriasis. There are other specified forms of pustular psoriasis as per ICD, International Classification of 11. Psoriasis, based on the distribution, we can classify it into scalp psoriasis, where the psoriatic lesions are seen on the head and a complete scalp. Nail psoriasis, this psoriasis attack the nails. There will be pitting sometimes, and onychlosis. Onychlosis is separating the nails from the nail bed. These are the forms of nail psoriasis. Flexular psoriasis. In this, what happens is wherever there is body who folds in the body, maybe in the axilla or popliteal fossa or any other fold, you will get this psoriasis. One more form is anogenital psoriasis. In anogenital psoriasis, all your private parts or anal region is in that region you will find the lesions of psoriasis.